Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last filled prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
Introducing our biggest GMC Acadia ever. Offering bigger screens, bigger views, and even bigger journeys. Live your biggest life in the all-new GMC Acadia.
This podcast is supported by Progressive, a leader in RV insurance. RVs are for sharing adventures with family, friends, and even your pets. So if you bring your cats and dogs along for the ride, you'll want Progressive RV Insurance. They protect your cats and dogs like family by offering up to $1,000 in optional coverage for vet bills in case of an RV accident, making it a great companion for the responsible pet owner who loves to travel. See Progressive's other benefits and more when you quote RV Insurance at Progressive.com today. Progressive Casualty Insurance Company and Affiliates. Pet injury is an additional coverage and subject to policy terms.
I was going to tell you a joke about dirt, but it's beneath us.
If you just went to bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Your show was better when you had medical questions. Hey!
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my inevitable woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Tacie, my wife. Hello, Tacie.
Hello, everyone.
This is a show.
Hi, everybody.
You were doing your Dave Landau impression.
I didn't mean to. I'm so sorry.
Hello, everyone.
Hello, everyone.
This is a show for people who would never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323, a.k.a. 347-POOHEAD, because Tacie won't say it.
Nope.
Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, or whatever. You know, I was just thinking, it's just really been in the last year. Did that dog just knock the fan off? How come
I think she did.
She's freaked out by the fan, and somehow she figured out a way to turn it off. What the hell?
Maybe she's not as dumb as we think she is.
She's dumb, but she's smart in certain things. Maybe she's like
sweet.
A savant.
Yeah.
She's smart in being sweet and smart in turning the fan off. That's weird. Okay, well, anyway.
Okay.
I was just thinking, this is one of our vacation shows, so it will be brief. But we'll try to answer as many questions as we can. But I was just thinking the intro has been so much more fun since I started intercalating those hateful comments that people made to our show. And each one of them is about 4 to 6 seconds long, and they fit perfectly with the intro. Here's the one that we're using now. Whoops. Uh-oh. Ah, dang it. Hang on. My fault.
Your show was better when you had medical questions. Hey!
That's my favorite.
But we also have this one.
You haven't answered a single fucking medical question. The fuck, man?
I've got diphtheria crushing
Is
my...
that the same guy?
No, I don't know. And then there's this woman who I love.
Can you please stop bullshitting and get to the question?
I've got diphtheria.
I mean, they're perfect. And then there's
I think
this
they
one.
just want questions, Steve.
And then there's this one. Well, she did.
God damn, this is about as boring as sex with my wife.
I've got diphtheria.
I mean, they fit perfectly. So I want to know who those people are, if any of those people are still around, because that was some old school stuff right there from way back in the early Sirius XM days. But there's this guy.
Your show was better when you had medical questions. AIDS!
And this guy.
You answered a single fucking medical question. The fuck, man?
And then,
Please stop bullshitting and get to the question.
and then this guy.
God damn, this is about as boring as...
Okay, so if you are one of those people or you know who they are, please get in touch with me. I don't know what we'll do. Maybe I'll send you some tchotchkes or something, but I just would like to give you recognition on the air because it's given me no end to joy. Just like Dee from Nashville, her phone call still is one of my favorite things that we ever had on this show. Let me see if I can find it. You remember, you know what I'm talking about? And you met Dee.
I remember meeting her, but no, I don't remember the...
Oh, my goodness. Let me see. This
we're not going to answer medical questions. We're going down memory lane today, everyone. This is memory lane day.
Let me see. I may not be able to find it. We are going to answer questions, so. Okay, here it is.
Hey, Dr. Steve. My name is Dee. I'm in Nashville, Tennessee. I am calling because you said something about a worse medical smell. I was sitting in with the dentist one day. A man came in. His jaw was swollen. The doctor had a round probe, was moving his jaw out of the way. The probe brushed up against whatever the lesion was inside of his mouth, and some shit came out of it that looked like green peas, like pea soup.
Okay, that's
and
disgusting.
The smell was so nauseatingly bad that I quit school, and I am a realtor now. I'm not doing anything in the medical profession because that smell was just like unreal. It was unlike anything I had ever heard before. So there you go. Hope that makes the air. Bye.
I hope it made the air. Yeah, it was dubbed as the greatest phone call ever. So, and since then we've had Dee in the studio. She's great on the air. If she didn't live so far away, 4.5 hours away, she'd be a regular. But anyway, it's hilarious. The shit smelled so bad that she quit school and went into real estate. As far away from anything that you could possibly do with regard to medical care. So that's great. All right. So, so if you are one of those people or you know who they are, we would like to get in touch with you. All right. Let's take some questions. Are you ready for that?
Of course.
Okay.
With my vast medical
Steve,
knowledge.
Charleston. How's it going?
Good, man. How are you?
That's good.
We'll be around your way a little
bit.
bit. Yeah.
Listen, I got to ask because it's killing me.
Yeah.
What's your opinion on ivermectin and COVID? Is it blown up? Is it being touted conspiracy theory, tinfoil hat type business? Or is it a legitimate, solution for treating COVID?
Well, okay, so yes and maybe yes. And I've got another. We had two questions on ivermectin.
Hey, Dr. Steve, this is Steve in New York. Can you listen to Joe Rogan, 1671? That's what Brett Weinstein is.
Dude, I don't have like 6 hours to listen to a Joe Rogan podcast, but I'm sure you'll summarize it.
Dr. Corey?
I love
Dr.
Joe,
Pierre
but Jesus.
Corey. And they talk about this drug for COVID called ivermectin or something like ivermectin.
Yep.
And they say that there's a lot of hope and promise in that. But
yes.
The CDC and WHO and even YouTube is shutting down all talk about it.
See, this is what's not true. Go to clinicaltrials.gov. If you want to see if the scientific community is giving this drug the proper attention that it deserves, because ivermectin is something that we give to people with parasitic infections, but it also is known to have antiviral properties. So the problem I have with so much of this stuff with COVID-19 is because it's become politicized. So everything that you said has truth in it, every single thing. Yes, it has promise. Yes, people are being censored, but here's the thing. If you want to know if the scientific community is giving it the credit or the attention that it's due, go to clinicaltrials.gov. type in COVID-19 for the disease and the keyword ivermectin, 72 studies. Here's ivermectin nasal spray for COVID-19 patients, ivermectin treatment efficacy in COVID-19 high-risk patients. That's recruiting. Clinical trial of ivermectin plus doxycycline for the treatment of confirmed COVID-19 infection. Ivermectin for severe COVID-19 management. Here's outpatient use of ivermectin. That one was withdrawn. That was at Temple University. There's 72 studies here, so it's a recent meta-analysis came out saying, looks like the data in some of these smaller studies is looking pretty good. What we need is a large-scale, randomized, placebo-controlled, double-blind, placebo-controlled study. It doesn't have to be placebo-controlled twice. That would be the Department of Redundancy Department, Tace. So anyway, but we do need that. And once we have that, and there's a statistically significant result that shows a positive result in whatever, symptoms, hospitalizations, deaths, any of those, we'll take it. And or transmissibility or adverse effects, long COVID, maybe it prevents long COVID, or maybe you give it to people early and it can prevent people from going into the hospital. Whatever the statistically significant positive result is, and the safety, in other words, the benefit outweighs the risk of taking it, the hell, we'll write it for everybody, that it's appropriate for, that we have data for. I am not cool with people getting on shows and saying, oh, this stuff is a panacea for this, because we don't know that. But I am also not cool, and I am way more not cool with this, is YouTube and other outlets just deleting people's posts if they're posting about ivermectin. I can get on right now and summarize these 72 studies, and there is a decent chance that my post will get tossed off of social media. That is bullshit. And as a libertarian, like I said, I'm not really cool with people saying it's a panacea, but that's their right to say it, and people have the right to make up their own decisions on this. They may not have the right to go to a pharmacy and just demand a scheduled, or not a scheduled drug, but a prescription drug that's required by the FDA. That we can debate. But people should be able to talk about it. And even if it's tinfoil hat stuff, which there may be, people should be able to talk about that too. I am very irritated about the censorship that goes on, which makes people that much more political, in my opinion. What sayest thou, Tacie? Oh, you're reading your Facebook, so.
Oh, yeah.
She just tunes me out while when I'm on my soapbox.
I agree 100%.
Do you? Do you even know what I said? It's okay if you don't. Some of these.
Well, no, I think the censorship on Facebook and all that's really just ridiculous.
Yeah. And see, here's this one. So ivermectin for severe COVID-19 management. The problem with it is they had 30 patients. These are kind of pilot studies. They had 30 patients in each of the control and study groups. During the study, 6 patients were excluded from the study group, so we got down to 24. As a result, 66 patients were included in the study, 6 were excluded, and the study was completed with 30 patients in both groups, so that's good. So I can't crunch this data on the fly to see if it's good data or not. It's impossible to do, but it's a very small study. I mean, it just goes on for pages and pages. But they will publish this, and you can look for ivermectin meta-analysis and ivermectin systematic review, and you can see where they've taken these smaller studies, pooled the data, and then got a statistically significant positive result. I'm fine with that, but that's not the same thing. And that just tells you that this bears a large-scale, double-blind, placebo-controlled study. That's what it tells you. So anyway. So, yeah, totally cool with studying it. It's obviously a drug that we have to study, and we need to know the answer because it may be, because ivermectin, hell, it's a pretty damn safe and well-tolerated drug. Now, if I had somebody that I'd tried every other damn thing on, would I push to try this? If I had any knowledge whatsoever, even a crummier study, an observational study that said it worked on a critically ill person, hell yeah, I'd advocate for it if everything else was failing. If they're going to die, if we don't do something, I would advocate for its use. I would have no problem doing that. You can do compassionate use for people if it's a last-ditch effort. But the problem is that's not what we're really interested in for these drugs. What we're interested in is drugs that we can give to people at the first sign of infection that will keep them from progressing to severe infection. And that you can't just start throwing drugs at people. You need to do that the right way. All right?
All right.
So, yeah, not being censored in the scientific community, people having opinions about it are being censored, and the people who are censoring them can kiss my ass. That's the best I can say.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
All right. Dr. Scott's not here, but this is one.
Hey, Dr. Steve, Dr. Scott.
Hey, man.
How are you? This is Paul from New York.
Hey, Paul. Thanks
Great.
for calling.
Good to hear. So
I always get
think
it wrong.
my question is probably more aimed at Dr. Scott.
Oh, well.
I have lower back issues, some bulging discs in my lower back, and I'm a heavy equipment mechanic for a living, and I was driving in my service truck the other day and was listening to the radio, and I heard an advertisement for a chiropractic firm that was in the area, and he was advertising a procedure I'd never heard of, saying it was a therapy called Cox Flexion Distraction, and it was some.
Well, if you're flexing on my cocks, I say I'm big and distracted, don't you
listen
think?
to you,
Taste, there
that's
you go.
funny.
All right, sorry.
Special table that you would lay on, and he would do these treatments on, and that after a few sessions, it actually could cause the bulging disc to recede back into its normal position. I was curious if this is a legitimate treatment, or I know there's a fair bit of quackery involved in some of the chiropractic.
Well, I wouldn't say that so much. There's quackery everywhere, and chiropractic has some pretty good data when it comes to back pain, no question about that. So it's when you get, well, I'll just leave it at there. So I'm looking at Cox Flexion Distraction. Says it's a gentle, non-force adjusting approach. So in other words, they're not cracking your back. The thing that most patients notice is the special table. The movements of this table help traction the spine, which Feels good, I'll tell you that. Opening up compressed spinal discs and reducing pressure on facet joints of the spine. Well, one of the problems is that we're upright a lot of the time. When we're not upright, we're supine or horizontal. But we're either putting traction, axial pressure on the discs between our vertebral bodies, or we're, flat on our back. But it's one or the other. And we never really kind of take that pressure off. When you're laying down, it's sort of neutral. But that we never do the opposite. So that's why I bought the inversion table. The inversion table for me helps to take the pressure off of the spinal nerve bundle that's being compressed by the fact that my spine is out of alignment with this thing called spondylolisthesis. That's where instead of stacking on top of each other, my vertebrae, one of them is more forward than it should be. And when it does that, it affects the shape of the hole that the two of them are supposed to make together to allow the nerves to pass through from the spine down to my leg. And so because of that, it's pinched all the time and it causes pain. Doing the inversion table helps to reverse that somewhat. And this looks pretty similar, but I think they're targeting people with bulging discs. And it says this highly effective technique combines osteopathic principles with the specific, highly directed approach used in chiropractic. The combination, let me see. It says, lying on the table, neutralizing the effects of gravity, we're able to gently separate spinal joints and move them through a more normal range of motion. Patients find this surprisingly pleasant. We find it powerfully effective. And then they use the example of an accordion, gently drawing apart each joint like an accordion allows the spine to reset, and the pumping action enhances soft tissue nutrition and rehabilitation. Well, I'm not opposed to this. I found a YouTube video. It's just Cox, flexion, and distraction. This one is 2 minutes and 56 seconds. We won't play the whole thing. I just want to see what it looks like.
Pro Chiropractic here again. This morning, I want to demonstrate for you guys a technique that we do in the office called Cox flexion distraction. It was invented by...
Boy, you got to be careful how you say that, though.
Dr. James Cox, and that's why it's named that. With this...
Oh, he owned that place where you could buy spirits.
The Cox Liquor Store?
Cox Liquor. Yeah, there you go, Tice. You got it. All right, let's see.
The technique we're going to do today is I'm going to be...
Okay, just show us how.
Well, it's a radio show.
I know. Okay, I'm trying. I just want to see what they're actually doing.
In here and help get some pressure released through those.
Now, so what this guy is he's laying on his stomach, and they have this table that is hinged right around the hip joint, and she's pushing on his low back and then pushing down on the part of the table where his feet are, and it's causing the hinge to flex toward the floor, and that's stretching his spine while she's stabilizing it at the same time.
Low back, those lumbar discs that get compressed very,
and it's
very
cracking.
quickly.
You hear that?
This is super helpful for someone that has disc compression.
Part of that is the
may be
table.
Going,
okay, so that's basically. Let me see if they do anything else here. Let's see. Okay. Okay. Now the table also swivels at the hip, so she can move his legs to the left or the right.
I've been on that table.
Have you really?
Mm-hmm.
Yeah. I think this could help some people. I really do. Mm-hmm. I think it's okay to try it. Look, chiropractic most of the time isn't that expensive unless you get into a thing where you got to go week after week after week after week. But I think I would try this for what I've got, because it's a mechanical problem. I have a mechanical problem where nerves are being compressed because of the way that my spine is aligned, and this thing looks like it could at least temporarily give you some relief by moving some of those bones out of the way. Yeah, I think this is cool. I thought it would be motorized, that it would be something that would be kind of undulating.
My friend in Myrtle Beach, we went to see a chiropractor. It was kind of like a massage kind of thing. But his table did that. And I have lower back issues, and it did feel really amazing.
Yeah, really? Oh,
yeah.
That's cool.
Yeah.
Well, there you go. Yeah,
A couple of years ago.
I'm cool with it. I know probably a lot of people thought that I would crap on it, but I'm not going to crap on that.
But definitely a question not for today, since Scott's not here.
Right, except I already answered it. I'm
Except
going to
for you
delete
already
it.
answered it.
Now, Dr. Scott would say also do that, but also come see a DOM. That's a diplomate of Oriental medicine. That's somebody who did a 4-year doctorate level degree in acupuncture, and they could augment that with some needles and stuff like that. So I'm telling you, that's what Dr. Scott would say.
Yeah.
And throw in some astragalus and you'll be fine. All right, here we go.
Hey, Dr. Steve.
Hello.
How are you?
Good, I'm well. How are you?
Yeah, I'm good.
Good.
Listen, I am a pharmacist, so
Excellent.
I should know the answer to this question, but it's not really something that we discuss in school. So I'm going to my favorite source of all things tricky.
Yay.
Which would be you.
Thank you.
So, here's the question. I take estrace, an estrogen cream, intravaginally. If I'm taking this regularly, like I'm supposed to be doing it twice a week, we'll say, for UTIs. Anyway, I want to know if I'm having regular sex with my husband, how will that affect him? Okay, thank you for your answer in advance, and I look forward to hearing it. Talk to you soon. Thanks.
This is a brilliant question, and I appreciate Dr. D calling in. Different D, by the way. There is actually, if you look at the package insert of the estrogen vaginal creams, which she's right, she's using it for recurrent UTIs, but really what it is she probably had a cystocele. So a cystocele is the bottom wall of the bladder is the top wall of the vagina, and when the top wall of the vagina gets thinned out because of menopause or lack of estrogen, then the wall gets weakened and the bladder will drop into the vagina. It doesn't have to do it much to then cause problems with incomplete emptying of the bladder. You can imagine that, if it's blooped down like that, you're trying to pee and you can't get everything out. If it's a really severe cystocele, it can sometimes actually prolapse out of the vaginal entrance, and those people need a thing called a pessary or they need surgery. But she probably had very mild vaginal wall weakness and problems with incomplete bladder emptying, which then results in higher risk of having urinary tract infections because there's more urine hanging around to get infected. So intravaginal cream can be used to thicken the wall of the vagina and strengthen that wall, that upper wall, so it returns the bladder to its normal shape, and you have better lubrication, better intercourse, all kinds of stuff. Now, if you look at the package insert, one of the warnings is avoid exposing your male sexual partner to your vaginal estrogen cream or suppository by not having sexual intercourse right after using these medicines. They don't define what right after means, but I would say that would be within hours. So with testosterone, you don't want to have intercourse if you're using testosterone in the chestal area, to have intercourse with your shirt off, with your partner with her shirt off within 4 hours. And now this stuff does absorb, but for him to get a significant dose, there'd have to be loose vaginal cream in there. So I would say 4 to 8 hours. And, if it's every once in a while, it's no big deal. It's just if you're using vaginal cream every day, which she isn't, she's using it twice a week, and then having intercourse every day, you could get a significant exposure to estrogen.
And then he would grow boobies?
Well, maybe.
Hmm.
That could be one thing. You just don't want to have an imbalance in your testosterone estrogen in your body, so he could get erectile dysfunction, he could lose his libido, stuff like that. I have never, by the way, I believe this is very hypothetical because I've never seen this ever happen. I've never known of it ever happening, and it would be interesting to see if there is a single clinical study at PubMed .gov. Let's just look male exposure to female intravaginal estrogen. So we're going to see if there's even a single article on that. And there's lots of them, but but it's all intrauterine. I don't see anything. Environmental estrogen. Nope, I'm not seeing anything that has anything to do with. Here we go. Absorption of vaginal estrogen cream during sexual intercourse. Now let's see if they talk at all about men. To determine if intercourse changed serum estradiol levels in women, using vaginal E2 cream or in their male partners.
Give yourself a bill.
So the results, serum E2 levels were higher in 8 of 10 men after intercourse with vaginal estradiol cream, and this resulted in a small but significant increase in the estradiol levels as compared to placebo. So it was small but significant. The P was 0.03. So yeah, paradoxically, intercourse resulted in markedly lower estradiol levels in women as compared to abstinence. What? So it says here, men absorb vaginal estradiol during intercourse, whereas intercourse reduces estradiol absorption in women. Okay, so yeah, sex right after putting it in is bad for the woman and bad for the guy. Although serum estradiol levels were only mildly elevated in men, it is possible long-term exposure could cause feminizing changes. In women, estradiol levels were markedly reduced by intercourse. So the question is, how long do you have to wait? I'm going to say 8 hours now. I'm changing it from 4 to 8. But maybe you don't have sex on the days that you put the estradiol, the estrogen cream in. That's interesting, isn't it? That is a delightful question. She wins the question of the week and maybe the month because we all of us learned something. So there you go. All right. I thought you were going to say something.
Nope, got nothing to say.
Contribute something while I was looking for another question.
Nope, not going to do that.
Oh, hi there, Dr. Steve.
Hello.
It's Natalie in Northern Ontario, Canada.
Hello, Natalie.
As I get ready to wrap up a school year, I'm an elementary school principal. We all know that elementary schools are just basically germ factories.
Yes.
So here's my question to you. Common colds, many of them are caused by coronaviruses. I just had my second Moderna shot,
Excellent.
which was protecting me against COVID-19, which is also a coronavirus. Because the mRNA vaccines are targeting the protein spikes, will they offer me any protection against common colds and other snot and boogers and whatnot that the kids are bringing into the school building? I'm just hoping that this will give me a little bit of extra protection on that front, too.
Yeah.
Be curious to hear what you have to say. Thanks much. Say hi
wait.
Hi to Dr. Scott. And you know what? I really miss having Tacie on the air with you. She was a good foil for you guys.
There you go.
Take care.
Oh,
Bye-bye.
that's very nice.
See, Tace.
She's lying.
The answer is we don't think so, but we don't know. We don't really know. We don't test for the other coronaviruses usually. When people die from coronaviruses during the non-pandemic times, it's usually people who are already really sick, the elderly, and they will die from what we call atypical viral pneumonia or just viral pneumonia or just atypical pneumonia, and they hardly ever test for them. There are some research studies that do test for those things. That's how we know that coronaviruses kill about 10,000 people a year, but it gets lost in the noise. So I think that for the next couple of years, we should be testing everybody for all of these viruses just to see if there is an effect from the mRNA vaccine on other coronaviruses. The reason that they're distinct is because their spike protein is distinct. And I think that's why really most people think that we're only going to get protection against this one, but we won't know until we do the studies. So, interesting. Yep. And I'm getting my booster study. We're doing this one several days before I'm going to have the booster, but it's going to air several weeks after. So we'll know if we see I Am Legend then we'll know that that things didn't go well when I had my booster vaccine. You remember in I Am Legend they had a cancer vaccine, and it was Emma Thompson?
I don't know.
Kenneth
Steve.
Branagh's ex, and she's like, "Yep, we've got this vaccine." It kind of sets you up thinking, well, if Emma's in this, I mean, she's a huge actress. She's not just going to have a bit part. And she says, "Yep, we developed this vaccine against cancer, and the cancer is going to be no more." And then it's like 2 years later, they just flash forward, and it's just zombies everywhere. Now, you should read the book. The book was, if I remember correctly, was also called I Am Legend. And the book, they were sort of vampire things. And I'm just going to spoil the ending, but
Don't do that.
well, it's, honey, the book came out in 1950. I mean,
oh, okay.
It's, but the upshot was, and it was so much better than the movie where he just shows up at this place and it's like, oh, we're safe here. It was like, no, he met with the zombie things, the zombie vampires, and they were like, dude, we're terrified of you. You can go out during the day, we can't, all this stuff. And they were as afraid of him as he was afraid of them, which I thought was kind of a cooler ending. Anyway, read the book that Day the Earth Stood Still came from too, and you'll find a much more interesting approach to that situation than was done in either one of the movies. Anyway, all right. Well, listen, thanks, Tacie. We can't forget Rob Sprance, Chowdy 1008, the Port Charlotte Whore, Vicks Nether Fluids, Carl's Deviated Septum, Steve Tucci, and Bernie and Sid, Fez Watley, and Ron Bennington, who supported this show, has never gone unappreciated. We're just out of time. I can't do the whole list today. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM Channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners and voicemails and topic ideas who have made this job very easy. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, Tace.
Bye, everybody.
All right. See you later.